Parents care about the well-being of their children. They want their kids to be safe and healthy and happy. The coronavirus pandemic has made all that more difficult. Measures aimed at curbing the spread of the virus quickly met resistance, from anti-mask rallies to conspiracy theories about vaccines. Families are caught up in the middle of all this, with many left wondering, what's good for my child? Welcome to a new edition of our COVID-19 special. I'm Monica Jones in Berlin. Good to have you with us. COVID-19 vaccine makers BioNTech and Pfizer have submitted initial trial data for a vaccine to cover 5 to 11-year-olds. Production is already being prepared. Good news, right? So let's get our kids vaccinated. Or is there room for doubt? We asked around at a playground in Berlin to listen to what both parents and children have to say about it.
A playground in Berlin. The news that COVID vaccines are soon to be available to children affects parents here. I'm a primary school teacher here in the neighbourhood, and I'm always hearing that children keep infecting each other. Despite that, I have to say that I'd wait. My daughter is 3 and the older one is nearly 5, and I don't know if I'd vaccinate them so quickly. My boy is nearly 3 and my girl is 7. It would be great if they were both soon to have immunity. Most of all because it's annoying to constantly have to test the children, especially the one at school. For months, BioNTech Pfizer has been working on vaccination approval for children from 5 to 11 years old. It says studies have proven the mRNA vaccine safe and effective. They say side effects, such as rare cases of inflammation of the heart muscles, are comparable to those in other age groups. Jakob Maske, a Berlin paediatrician, advises parents in Germany to be patient and to wait for the recommendations of the National Vaccination Commission, not least because children are far less at risk. We want to ease parents' concerns. We now know that a child's immune system functions differently to that of an adult. In the mucous membrane, in the nose and in the throat, they have a significantly better defence than we adults. They fall ill significantly less often. Coronavirus might circulate among children, but according to the Robert Koch Institute, Germany's Federal Agency for Disease Control, most cases are either asymptomatic or follow the course of a mild illness. Children are also no great danger to risk groups such as the over 60s, as more than 85% of that group is vaccinated, according to a doctor from the German Society for Immunology. That means it's currently not necessary to vaccinate children to minimise the risk of bringing the infection into the family. Of course, it's good if the children are also immune at some point, but ultimately you have to say clearly that whether they get this immunity via vaccination or infection, both represent a very small risk. And what's the word on the playground? Would the children take the vaccine? I'd do it if my parents were okay with it, and they definitely would be because it makes more sense. Yes, as long as it doesn't hurt.
For more, I'm joined by Professor Roland Eils. He's a director of the Digital Health Center of the Berlin Institute of Health at the Charité. Good to have you with us. Now, luckily, we know that compared to adults, children have a substantially lower risk of getting severely ill when infected with COVID. Why is that? What is the secret?
Well, the secret is very simple. So whenever we need to activate our immune system to defend a viral infection, we need so-called pattern recognition receptors to be activated. And these, once they are activated, they actually trigger downstream production of interferon, which is the primary defense line of our immune system against any viral infection. Now, we have found that children are immensely effective in those activation of these pattern recognition factors in comparison to adults. As a matter of fact, they actually happen to be pre-activated, and as such, they recognize the viral infection immediately and can start interferon production and defending the virus immediately upon infection.
But it doesn't work as well with other viral infections. I mean, they can still get the flu. What's the difference there? Do we know why a child's immune system reacts so differently?
Yes, we have very clear indication that the coronavirus itself is very effective in shutting down this early warning system once they infect a cell. Now, this is in contrast to, for example, the flu virus, the influenza virus, which actually comes along with a modest activation of the interferon defense system. And as such, we believe that in those infections with the flu, we do not depend so much on the very immediate response and interferon production itself. And that makes a difference between the coronavirus on one side, which actually requires a very effective and quick response in comparison to the influenza virus.
Now, if children usually fight the virus off more quickly than adults, does this mean that they're also less infectious? And if not, should they still wear masks? Would that help?
Well, to the first question, if you agree that there's a relationship between the viral load and the infectiousness of this individual, initially both children and adults should be equally infectious because their initial viral load is quite comparable, as shown in a couple of other studies. Now, we have shown, and others have also confirmed that the children are very effective in more quickly reducing the viral load, and as such, we would speculate that they are much quicker in getting less infectious over time. So to the second question, yes, it's still helpful to wear masks because initially before, even if you develop your first symptoms or even if you're asymptomatic, you're still able as a child to spread the virus for the first days after infection, and as such, wearing masks is still a very effective protective measure.
Now, with all of that in mind right now, would you advise parents to have their healthy children under 12 vaccinated once that's possible?
Yeah, I would clearly answer to this question with a clear yes, for two reasons. First of all, there's still an individual risk to get severely ill with COVID-19, even as a child below the age of 12, even though the risk is very low. So we do know that 1 in 5,000 infected children would develop a severe course of COVID-19. Still, the risk is still there. On the other hand, given that the individual risk is quite low, the societal risk overall is very high. Just as an indication, in Germany, we have a little bit less than 8 million children below the age of 12. And if only if you assume that with the Delta virus, the vast majority of them will get infected, 1 in 5,000 out of 8 million is still a pretty large number.
All right, Professor Eils from the Berlin Institute of Health at the Charité here in Berlin. Thank you so much for your time and for sharing your insights with us.
It's a pleasure. Thank you.
Now, one worrying side effect of the pandemic is an increase in child labor. In developing countries, lockdown measures often meant the loss of income with no compensation. Here's a story now from Ghana, where more and more kids are forced to pick through rubbish for scrap metal and plastic to sell to recycling dealers. It's a hazardous job that hardly helps to make ends meet.
This would be dangerous work for anyone, but even more so for children. These youngsters have no choice but to expose themselves to the danger of this trash, just to eke out a living during the COVID-19 pandemic. Muhammad Latif is scavenging for plastic and metal that can be recycled. Here in Ghana, children are on the front lines of the scrap business. Picking through the garbage is how I earn my living. I can sell the scrap material to dealers. Life is expensive now because of the coronavirus pandemic, and people are dying. If I scavenge like this, I can provide for my needs. The children are also exposed to exploitation. The dealers who buy their materials are not that much better off themselves. They are also just trying to survive. There have been reports of dealers cheating children, paying them less than what the materials are worth. They use the scrap metal to make pans, zinc and aluminum from vehicle parts. With a surging number of children collecting waste in Accra, exploitation by dubious dealers is taking place more frequently. This is just one of the tragic results of the pandemic in Ghana. Not only are more children being exposed to dangerous toxins, but to exploitation as well.
Before we go, here's a look at some of the other COVID-19 stories making news around the world. Russia reported a record number of daily corona deaths on Sunday, reaching 890. The country has the highest death toll from the virus in Europe, totaling nearly 210,000. Health workers say the lack of young people getting the jab is prompting the spread of the virus to relatives who subsequently die. New Zealand will phase out its target of eliminating the coronavirus within its borders. Pressure has mounted on Prime Minister Jacinda Ardern after a series of strict measures, including lockdowns and prolonged border closures. She says the strategy will shift to learning how to live with and control the virus. Merck says it's almost ready to seek authorization in the United States for the world's first pill shown to treat COVID-19 directly. The drug company says molnupiravir reduces the chance of hospitalization and death by half. Australia's government has also already expressed interest in the medicine.